broadcast is now starting. All attendees are in listen-only mode.
Good afternoon. Today is Friday, January 28th. I am Donna Will, Professional Development Coordinator for the Maryland Developmental Disabilities Administration. We welcome you to the monthly series of DDA updates with Deputy Secretary Bernie Simons. On the panel today, we have Bernie Simons, Deputy Secretary for DDA, and the leadership team, Robert White, Director of Administrative Services, Rhonda Workman, Director of Federal Programs, Patricia Sestoki, Director of Programs, and Carrie Zanchi, Office of Change Management. Before we begin, I'd like to go over a few things about the webinar. All participants are in listen-only mode. There are two options to hear the webinar, by computer and phone. If you look at the panel interface on your right, labeled audio, you can click either computer or phone to switch for the best option. There is one handout for the webinar, which can be uploaded from the handout section, or if you are listening by phone, you can request that they be emailed. We will be recording the webinar and posting this session on YouTube and the DDA website. Questions can be typed in the question or chat box in the webinar panel, and we will get to those towards the end of the presentation. So now I'd like to introduce Deputy Secretary Bernie Simons. Good afternoon.
Good afternoon, and I welcome everyone who is attending this webinar again. I want to thank you for being here. This is our first webinar, obviously, of 2022, and we initiated these webinars when the pandemic first started, so it seems like we've been doing these for much longer than 2 years. But again, I want to thank everybody for your participation in being here and all of your questions and feedback and concerns that you might have and that we can help address and collectively work through this together. So I want to take a few minutes again to say that we want to continue to partner with everybody. We know we've had a lot of challenges. I think collectively we've all done real well so far with the challenges of the COVID-19 pandemic, and with your input we were able to make some positive changes, obviously around Appendix K, and people with their families, and people going home with their families, residential providers basically doing day supports when people were in their homes, provider-owned homes. And so today we want to give you a brief update on the COVID response and focus on the flexibilities that we've had, and what we're doing with person-centered and family-oriented support. So I think it's extremely important that we continue to collaborate. And again, Governor Hogan has renewed his commitment to improve the quality of life for all Marylanders through the proposed budget, and you'll see about where we are with our budget recommendations that the governor released a little while ago, and what DDA looks like. And obviously we want to talk about our 6 focus areas as we move into 2022. So next slide, Donna, please. So we've got the surge with the Omicron variant, and it's important that everybody considers a vaccination and boosters. And I want to thank all the providers and everybody who is partnering to provide booster clinics. And we continue to remain very proud of the work that everybody's done in keeping everybody safe. Individuals we provide supports to, their families, staff, etc. Please remember that your local health department also remains a key partner for testing and protective PPE. And they have supplies also of KN95 masks, etc. And some of them have at-home tests. So please stay in contact with your local health department. And I'm also aware of the local libraries and your counties and other resources that have supplies also. So as of, you can see, as of January 26th, we have 1,051 people who have had boosters, which is a good deal, because everybody's going to wait 6 months and everybody wasn't vaccinated initially right away. So we need to continue to move forward as we make progress and continue to look at what's on the slide. You can see the different 4 regions and what that looks like, and where we are with the increase of 1,000 since the last month. So actually it's 4,301 total. And so if I said it, that was a total, I misspoke, I apologize. So it's 4,300, and obviously it's 1,000 people who have, since last time we did this. Next slide, please. So we've done a lot of talking about Appendix K throughout the pandemic. And I think we started these in March of 2020, and it's coming up on 2 years. And we learned a lot and got a lot of feedback about the flexibilities and supports. Last month, we announced that Secretary Schrader made a decision to extend Appendix K flexibilities through March 31st. They were initially scheduled to, I believe, stop in December, and then we went a little bit further beyond that, and now he's extended it again to March 31st. So this means that individuals, families, and providers can continue to use all the flexibilities that you've been using right along. This extension will also allow us to plan for any transitions that we need to do as as the numbers come down. If anybody saw the governor the other day on television, he was talking about we have the best in the country when it comes to the numbers and the lowest rates, et cetera. So please continue to work with your case manager, CCS, and your providers so that we can continue to figure out what we're doing with scheduling staff trainings and completing new self-direction forms for families that may have hired people, et cetera. So, again, this is not just a one show stopper with DDA. It's everybody who's on this call and everybody who isn't on this call who hopefully will review this webinar at a later date. Next slide, please. So many of you know, obviously, that we've had some issues with the network, and I'm just pleased to announce that PCIS2 is undergoing some internal reviews, and actually we've reached out to some providers to begin testing today. I didn't want to just go and say, okay, all of our providers just go into PCIS2 without doing a little bit of a test to see if there were some glitches in the system. We had to move that from the server that was on to a different server and make adjustments, et cetera. And many of you know that PCIS2, sometimes when you touch one piece of it, is an untoward consequence. It might touch something else or impact something else, and it's not really clear why that happens to me at times, but it does happen, and we want to be very, very conscious of this, especially knowing that some of the providers are working on the fiscal impact tools for our rate studies. And as we move forward, and people have said, gee, I really need to get that information out of PCIS2. So we will do a short pilot testing today with those providers, and then we will obviously make members of the DDA team who've been working long on this, and again, have people on this call, because we had to do workarounds for obviously our incidents and other issues. So we want to make sure that we continue, and you may recall that last week I put out an email that basically extended the cost reports to the end of March. So I think we're in good shape with that, and hopefully have this up within 7 to 10 days, if not sooner. Next slide, please. So we have the pandemic, and we know that There's been a lot of demands and a lot of changes, but our vision for people with intellectual and developmental disabilities is still to have full lives in the community, to be able to participate as active citizens. None of that's changed. Our mission is still the same. We continue to be guided by 6 areas. We have self-determination, which we promote, self-advocacy, which we have people on the go do a lot of training on people advocating on their own behalf. Mary Ann Kane-Brushy obviously works with us on the life course and supporting families. And then in independent living, which is really supported living. Our employment, which we thank the providers who early on developed us as a employment first. And lately we added one more, and that's assistive technology. And we've been talking about assistive technology and becoming a self-determination first state. We're an employment first state already, and then becoming an assistive technology first state. And we learned a lot during the pandemic with the flexibilities and the areas that people had to be able to work through experiencing things differently than they had in the past. You know, a lot of remote through day services when people were in their residential sites, etc. So as we continue to move forward, we'll continue with those 6 areas and ask for people's input and, you know, guidance, etc. So the governance budget will enable us to offer more services, and you know, as we go into LTSS, we'll have additional services that people can experience versus what we currently have. The opera spending plan provided rates to the providers to hopefully make a dent in where we are with hiring additional direct support professionals, because we've heard about that all during the pandemic. We also have ARPA grants that will be going out to provide opportunities for innovative service models, and also help the providers excuse me, transition to a fee-for-service for billing. And the LTSS provider billing expansion will also give a lot more flexibilities to everybody. And, you know, as we move forward with our rates with our stakeholders, excuse me, I'm sorry, we will continue to review policies and ask for your input. And with that, I'm going to ask Robert White to pick up the next slide.
Thank you, Bernie. Okay, great. We're on the correct slide. So the FY23 Governor's Allowance for DDA totals approximately $1.549 billion. That's a 6% increase over the FY22 appropriation. And as you can see, 1.538 billion is devoted to community services. The FY23 Governor's Allowance for DDA features a number of highlights, such as 18.6 million for transitioning youth, 9.8 million for the DDA waiting list, 5.5 million for low intensity support services, as well as 53 million for continuation of the annual 4% COLA. And so those are just some of the highlights. Next slide. So the execution of our spending plan is underway, as we have already provided a retroactive rate increase to providers providing services in PCIS 2. That was effective April 1. And then, you know, obviously we put the 5.5% increase in place effective 7/1 for FY 2022, also in PCIS 2. And many of you are probably wondering about, you know, because it's shortly after we loaded those rates, the system went down. And so as Bernie mentioned, Once we get beyond the soft launch of bringing PCIS2 back online and open it up for everyone, then we'll immediately start sending out details regarding quarterly payments and reconciliation, et cetera. In addition, I'm pleased to announce that we finally received approval from CMS to provide the non-competitive and competitive grants to providers. We mentioned these at previous webinars. We're allocating $50 million to non-competitive grants for DDA providers and then $10 million for competitive. We are currently working on our internal process. We are working with a software vendor because we want to automate and streamline the application process, as well as make it easier for you all to manage the process moving forward by making it easier for you to submit documentation, et cetera. So these grants, will go a long ways in helping providers with a range of activities like staff retention, assisting with the transition to the fee-for-service environment in LTSS billing, supporting consumer choice, as well as promoting and enhancing community integration. Next slide. So the Maryland Department of Health recognizes that rate setting needs to be an iterative process, relying on annual review. And Medicaid is taking the lead in creating a new rate review advisory group to review data and other information on a regularly scheduled annual basis. That way, we have the latest and greatest information informing our decisions as we move forward in partnership with you all and other community members. While this is especially critical as we are expanding provider transitions over the coming fiscal years to new rates and a new rate methodology, this new annual structure is also consistent with what we already have in place with other Medicaid entities. MDH is developing this new rate setting structure in partnership with both IDD providers and community stakeholders, and we remain very appreciative for the contributions they have made to our rate development. This new rate review process is scheduled to commence in mid-February, and again, we want to thank you all for your strong interest in providing, input into that process. As part of the process of establishing the budgeted LTSSMaryland fee-for-service rates for FY 2022, the provider fiscal impact analysis tool was designed to compare revenues that providers received under legacy services and the prospective payment methodology through PCIS2 to projected revenues in LTSS Maryland fee-for-service using those new budgeted rates. I'm pleased to announce that we have received 118 submissions, and we are conducting a careful review before they are submitted to Hilltop for analysis. And the reason for this review is to identify if there's any missing information, anything that kind of sticks out like a sore thumb in the data. And where needed, we'll be scheduling calls to providers over the next week just to confirm these questions. We will work with each provider should there be agreement about any revisions or updates. But it's important to know it remains our goal to send these tools to Hilltop in a completed state, so that we don't, introduce any complications into their timeline. These tools and the plan analysis is very important to informing rates and rate priorities for the new rate review structure. And we are appreciative of the providers' time and effort to complete these tools and to Max for supporting the rate work this fall and the technical input into the tool, trainings, and fiscal impact analysis process. Next slide. Okay, so I am pleased to announce that the LTSS Maryland DDA module expansion in this coming year is being carefully planned. This next phase of expansion is for providers who are interested. To assess the interest to support readiness planning, a recent survey drew 96 responses, with 66 or 68% of providers reported as being interested. And you know, those are some impressive numbers. We were glad to see that feedback. This survey also asked providers to assess and to share their status across 11 what we think are key readiness areas. These are areas that we have identified as showstoppers if providers are not able to demonstrate readiness in any one of them. And so using the earlier pilot experiences, these areas are key to successful transitions. And so the regional directors will be outreaching to each provider in their region to review these responses, and based on these responses to discuss the scope and timeline that would make the best sense for each interested provider. And so we want to thank you for completing the survey. We know that at times we're throwing a lot at you as we, seek data to inform some of the decisions we are making. So, and we understand that you all are running organizations and providing services, and time is of a premium, so thank you. The spring expansion will be small scale and will use a phased-in transition with providers who have all or most areas confirmed as being in progress or completed. The regional directors will work individually with providers to support their readiness planning and flexible timelines to ensure success. And so, we will be offering this expansion in 2 phases. One which will take place between April and June, the second phase between July and September, at which time, we would take a pause to reassess where we are and update our playbook or any other implementation checklist that we may have developed. Next slide. So the expansion planning for this calendar year is being supported by the Maryland Department of Health in several ways. For example, restructuring LTSS work groups with medical provider services, co-leading to focus on operational components and development prioritization, establishing annual rate setting process with stakeholders aligned with other Medicaid rate setting structures, as we already mentioned, focused training to support provider, CCS and DDA regional office readiness, release of the LTSSMaryland DDA module playbook. Big shout out to the early adopter group who has been working with us on this, increasing a regional office personnel dedicated to LTSS Maryland expansion to ensure that we have the necessary resources in place to support the expansion. Next slide. Oh, I'm sorry, Rhonda, I'm going to turn it over to you.
Great, thank you, Robert, and good afternoon, everybody. Next slide, Donna. So the DDA fully supports self-determination and has established SelfDirection as a service delivery model and one of DDA's 6 priority focus areas. Patricia and I are going to now provide some updates related to our focus areas and some of the strategies and initiatives that we've got in place and looking forward to in this next calendar year. As noted in the Maryland State Disability Plan, individuals with disabilities determine how they wish to live. They have the right in the ability to participate in the design of their support systems and the opportunity to live and participate fully in their community. They make decisions, and under one of our service delivery models, the self-directed model, they determine how their self-directed budget is spent and make decisions related to who they want to hire, work schedules, and pay rates. People choosing the self-directed service model for DDA services and supports continues to grow. Our number of participants that are self-directing their services has increased significantly since our initial implementation in 2005. In 2005, when we first began, our first year, we had 41 individuals participating in self-direction. And today we have approximately 1,800 individuals and look forward to further expanding and growing this option. We're really excited about the new year and these new opportunities for DDA's self-direction initiatives. Next slide, please. First, I'm extremely happy to announce that we have hired a new statewide coordinator of self-direction, and her name is Christy Colbreth. Christy is an experienced support broker and training facilitator. She has led customized employment initiatives and has been certified by Customized Employment from the Association of Community Rehabilitation Educators, or ACRE. Christy will be joining us in February, and we look forward to sharing more information and an announcement. Some additional things that we want to share that we're working on and to look forward to in this new calendar year. First, to enhance our fiscal management services with best practices and provide more choice of providers. The department is procuring up to 10 vendors to support self-direction among Medicaid programs, including the DDA waivers. As more information becomes available about the awarded vendors, we will share information and options for participants and families to consider. We are also working with the Applied Self-Direction, which is a nationally recognized organization, for the creation of coordination of community service training modules specific to self-directed services. These training modules will include the philosophy of self-direction, best practices on discussing and promoting this option, and training on the creation of a self-directed budget. The DDA will be partnering with self-directed advocates and our partners to provide input on the training modules to ensure all perspectives are heard and the training models are robust. Next, I also wanted to share that this month, the state submitted an application to participate in a new National Center on Advanced Person-Centered Practices and Systems learning collaborative, which is specific to self-direction. This learning collaborative will be led by the Maryland Department of Disabilities and will bring together a team of people with professionals and lived experiences to engage in peer-to-peer learning as we pursue a common aid to enhance self-directed services among our various programs, including the DDA's program. We will continue to work with self-directed partners and advocates for enhancements to our processes and our forms. We will be sharing some updates next week related to some revisions on the participant agreement and family of staff form. And finally, the department has received the initial recommendations from the Health and Government Operations Committee related to the Self-Direction Legislative Work Group. And we look forward to continued collaboration and partnership and the final report to further enhance the flexibilities of self-direction. Next slide, please.
So now I'm going to talk to you about our advocacy, self-advocacy. I think that it ties in really nicely with Rhonda and what she's just shared with you. You know, self-advocacy is one of our 6 focus areas that we have been working on and have partnered with people in the Go Maryland in the Maryland Center for Developmental Disabilities, or AMSTED at Kennedy Krieger Institute, to train self-advocates from across all regions using Project STIR, Steps Towards Independence and Responsibility. And so we really want to have this opportunity to share with our advocates of this wonderful opportunity. And on the slide, I put the website if you're interested in following up and in joining some of those trainings. Next slide, Donna. One of the things that I want to remind everyone a little bit about is that under Bernie's leadership, he wanted to make sure that we really walk the walk. You know, don't say it, but really implement. So one of the things that he really wanted us to emphasize and work on is to really have DDA self-advocates across all the regions. So a position was created in all the regions. And so we have a self-advocate in every region. And right now we are in the process of interviewing for the Southern region. Our self-advocate specialists have personal experiences using the similar services that DDA waiver participants and other people with disabilities use, like Social Security, doors, paratransit. And this allows the DDA to support self-advocate movement of nothing about us without us. So we really want to make sure this is really a core element that we really want to embrace self-advocacy in our focus areas. The DDA specialists have an insider knowledge of how to navigate the services that someone without disabilities may not have. The DDA advocacy specialists assist people who are applying for DDA services, people already receiving traditional or self-directed services in their families. So for example, they build relationships with self-advocates, self-advocacy groups, and their teams and families to, to provide resources and information about DDA, the community, federal and state programs to help explain what services and supports are available. They also conduct webinars, provide training, and make presentations to community groups on topics such as employment, transition in youth, mental health, assistive technology, safety, and housing. Next slide, please. So you can reach out to our DDA self-advocates like Cody Drinkwater out of Eastern Shore, or Jessica Stein from Western Maryland, or Cheryl Gottlieb out of Central. And right now we don't have one, like I said earlier, in the Southern Maryland region, but ONESTA, our regional directors, in the process of interviewing for that position. But please, take this note and see how you can reach out to them. They have their email, cell phone, so they're available to you. Next slide. You heard Bernie earlier talked about, the hiring of Mary Ann Kane-Brushy. Supporting families is another critical and important focus at DDA. Our goal is to create practices and provide services that promote maximize the capacity, strength, and unique abilities of families to support their family members to live their best life. One aspect of this is to provide opportunities for families and connect and network with one another so that they may learn from each other and build knowledge and skills in the community. We are also learning from families. This is so unique because we've learned so much by engaging and hearing their concerns, what's working and what's not working. So another aspect is to increase our resources and supports and services based on what we hear, and not only on eligibility specific, but our community and natural supports. And if you want to know more about our supporting families, please reach out to Mary Ann Kane-Brushy, who would be available to support you and assist you in any way that she can. Next slide, please. As I talked to you a little bit earlier about the leadership, since 2016, the DDA has focused on supporting families and hire Mary Ann. We are so excited that we are now going to have, under her leadership, and have established the community of practice for supporting families. We'll be hiring regional coordinators of family supports in each region who will be trained on Turning the Life course, assist families in navigating state and local systems to obtain supports and services they need in collaboration with the coordinators of community services, and provide ongoing person and family-friendly information sessions, as well as to facilitate peer-to-peer network opportunities and much more. The other piece that we really focus on that I wanted to just remind everyone about our family supports waiver. We've developed and created this wonderful family supports waiver to assist families who were and are caring family members on the DDA waiting list. And we will be focusing this year on increasing participation and access to these services. So if you want to know more about that, please reach out to Mary Ann or Rhonda Workman or myself so we can assist with that. We've also been conducting lots of supporting family webinar series have been very, very successful. We've been hosting them. They're interactive. They're designed to increase family engagement where people receive services and their families can speak directly to us, to Bernie, to Marianne, to the leadership about experiences and ideas. And this really has set a pathway for us to really look at robust supports and services. So we will continue to do that. Also, we have the Maryland Community Practice webpage. And I put the link on the slide so that you can see it. But the Maryland Community Practice has a webpage located on the National Community Practices for Supporting Families. Has great information, and so I think it's very useful. And out of everything that I wanted to say for today is, in spite of COVID in this public emergency, the Maryland Community Practice for Supporting Families identified, initiated, engaged, and supported multiple activities transformational in nature that taking place in Maryland to affect our systems change, to enhance the lives of people with developmental disabilities and their families across the lifespan. And we are very, very grateful to our families for their support and ongoing communication with the DDA. It is just, can't say more about that. Next slide. Oh, this one is one of my favorite ones. This one is, as you heard Bernie said, our independent living is really our supported living, it's really our housing. So it's another important focus that we really want to make sure, how do we enhance and create accessible, affordable housing, supported living, and create resources to enhance housing opportunities for people with developmental disabilities by partnering with local, state, federal entities to enhance those opportunities. So people can choose where and who they live with, increase the opportunities to use and learn new skills, have opportunity to live just like you and I live, everybody else, and be able to choose and make some long life decisions that affects their lives. Next slide, Donna. So one of the things that I just refresh in your memory, you may remember that Bernie established a supported living advisory committee back in January 2018. And that committee met for a whole full year. And at the end of December, they actually gave us some recommendations. And that committee included 30 people, individuals were present, families, advocates, parents, statewide providers and advocacy organizations and state government entities. The committee concluded its work in December and they submitted recommendations to Bernie, the DDA, that would promote independent housing situations. One of those recommendations was to create a state-funded tenant-based rental assistance program that would be available to DDA eligible people statewide. And other recommendations was to create a new nonprofit, which would be a catalyst for the development and identification of affordable housing. And so I'm just really excited to say that we are moving forward for that. Next slide, Donna. And you can hear my voice that I get so excited. So I'm just happy to share that we will be introducing this coming months in partnership with the Department of Disabilities on the rental assistance program, which will operate very similar structure to the existing Weinberg rental housing and the Section 811 project. So the waiting list will be managed through the Maryland Department of Disabilities and subsidized and inspected will be done by the Maryland Department of Housing and Community Development. And I know this sounds really good and great news, so just stay tuned. We're going to put together communication and a plan and tell you where to go. So we've created this partnership with the Maryland Inclusive Housing 2 Corporation to focus on the 3 main goals that they've recommended. And that was to facilitate the creation of a housing teams in the regions or counties throughout the state of Maryland, to employ community living coordinators who would work as housing case managers for people who are receiving DD services or are on the DDA waiting list, and to be a housing information clearinghouse for the DDA. So we, and one of the part about being a clearinghouse is that we provide information to people in services, families, or coordinators of community services or providers. And so it's kind of a one-stop shop for information. So on the slide is the link where you can see how to get more information. The next one, I think is dear to Maryland and to all of us here, is employment. We are an employment first state, and we want to facilitate full inclusion of people with the most significant disabilities in the workplace and community. And under employment first approach, community-based integration employment is the first option for employment services. So we really want to make sure that you all know how committed the DDA is in enhancing this community employment options for people. And then we've created an additional services and opportunity to use a combination of meaningful day supports and employment services to really move into that path to employment and community life. Next slide. So all of you know that for the last several years, we've partnered and collaborated with multiple entities. And part of that collaboration will continue with DOORS, with MSDE, and with our other partners to continue to make sure that we focus on community integrated employment. Some of the things that we've done have been top-notch, state-of-the-art. We've been lots of webinars because Maryland has been doing really good with employment, regardless under the public health emergency. We've partnered and collaborated. We've also partnered with Inclusive Higher Education. We've offered grants to two entities, the Coppin State University and Harford County, and they really are focusing on employment and community activities, and we will continue to do that. We're also going to continue to, based on things that we've learned with the early adopters, is to put together some training modules and help providers, families, and participants understand how do you braid and stack some of those meaningful day services so that you really can expand and create a meaningful day for yourselves and for your loved ones. Next slide. Assistive technology. This is our newest in addition to our focus areas. And if you remember, we had 5 focus areas for many years. And in the last year and a half, we've included assistive technology. So our assistive technology is I think something that we have learned a lot about during the pandemic. And DDA has partnered with the Maryland Department of Disabilities and other stakeholders to make Maryland an assistive technology first. You heard Bernie, our Deputy Secretary, said that really wants to make us a employment first state. So can you go to the next slide, Donna? So this is just to kind of give you a little highlights about where we are with technology. First, I want to say, look at the right-hand corner of the slide, and it shows you that Maryland Technology First, the committee that was created, put together and created this logo. They also put together a whole team to look at interdisciplinary work groups and technology initiatives. They're conducting an environmental scan and evaluating our regulation, funding, or services. And they also created a vision, and that vision is technology first, a state initiative to empower all Marylanders with disabilities to have access to technology that would enhance their ability to pursue the best life as they defined it. So this is really fantastic. So, you know, we really are going to be doing a kickoff this summer. We will start with the governor's proclamation, keynote speakers, and much more. So please stay tuned as we will share more of Maryland Technology First initiative. And so I'm now going to turn this back to our Deputy Secretary, Bernie.
Thank you, Patricia. Before we conclude, I want to take a moment and announce that Bianca Renwick has welcomed the opportunity to assume the acting role as the director in the Central region. I appreciate her leadership and dedication to the CMRO. As you know, before that, she spent some time in the Southern region. She's very well experienced and very well talented. I also want to recognize the strong contributions that Nick Burton made to us, starting in the Southern region and then spending most of his time, I think, in Central. And he's positioned us in the Central region well, and we will have that progress to keep moving under the leadership of Bianca. So just please remember that the DDA regional offices are your partner. Don't hesitate to reach out to the regional directors or provider service specialist or the quality enhancement. I mean, we're all in this. You don't have to go through the regional director to get to some of the staff. And if you've got a question or you want to bounce an idea off somebody, and I think I'm proud to be part of the statewide team. I think we've done a good job. It's taken, I think, a little bit of time to get us positioned where we are today. But again, I think that DDA is, from the state's piece, is at a strong point to continue to support individuals, families, and providers in throughout the state. Next slide. So remember that we're doing these monthly. This slide has a link that you can share with colleagues and families, participants, etc. After registering, you'll get an email notification and information about how to join the webinar. And I want to thank everybody for attending today's webinar. The questions that you may have posted in the question box. And we, again, always value your feedback, and we'll review if we can't get to the questions today with the answers. Since we've only got about 13 minutes, we will be updating the DDA's frequently asked questions. And again, we can only get better as we continue to take everybody's interest at hand and to build a stronger system so that we can be the best that we can be in moving forward. And I look forward to continue to working with everybody in 2022. So with that, we can open up for any questions that we might have in the chat box, etc.
Thank you, Bernie. Yes, there are some questions in the chat box. I'm going to start with, there's lots of them for Robert. So I'm going to start with Rhonda and then move to Robert. So Rhonda, it was just announced today that Appendix K for autism waiver services has been extended to October. Will that also happen for DDA?
Yeah, thank you for sharing that, Patricia. We have confirmed with Medicaid that there has not been an announcement about the extension of the Appendix K waiver. Any questions related to the autism waiver Appendix K should be directed to the Maryland State Department of Education, specifically Tiffany Hobb, who is the section chief of the autism waiver and health related services. So again, we have confirmed with our Medicaid office there has not been an announcement of an extension of the autism waiver Appendix K.
Thank you, Rhonda. I'm going to move to Robert for the next 10 minutes that we have, and I'll start with the first question on the question box. With the COVID flexibilities being extended through March 31st, would headquarters be changing the end dates of those services in PCIS, or will that be up to each regional office to do?
Sure, thank you, Patricia. And the answer is yes. In fact, the task order for that to happen has already been submitted, and they should be following up on that shortly.
Thank you, Robert. The next one is, are competitive grants of $50 million over and above? What is the governor's FY 2023 budget? Which I think you share, but I think that, I don't know if you wanted to summarize it again.
Yeah, so the answer is yes. The $50 million for the non-competitive and the $10 million for the competitive grants are above and beyond what's in the governor's budget. As you recall, the grants are being funded with the ARPA savings, and 100% of those savings have to be reinvested into home and community-based services.
Thank you, Robert. The next one is, when you said continue the 4% increase, does this mean a continuation of the current rate increase? For example, rates will actually remain flat-headed until the next fiscal year, or a 4% increase on our current rates?
Thank you. Great question, and thanks for seeking clarification. So yeah, this is an additional 4% increase that will compound what the current rate is today. And so, July 1, those rates, that today's rates will increase by 4%.
Thank you, Robert. The next one is, what is the target date to send the tool to Hilltop, and what is their turnaround time?
Sure, thank you. So our goal is to send the first batch to Hilltop probably by the week after next. I don't have a calendar open to see the dates, but yeah, that's our goal. And so in our conversations with Hilltop, what they will do with that first batch is they'll do data validation, and then they will write some code or do some programming that will then do the analysis. It is at that point that they will be able to communicate back to DDA a timeline. And once we have that timeline, then we can share that timeline. And then obviously that timeline is very important as it informs our overall timeline as well.
Thanks, Robert. The next one is a statement and a question, and it's in reference to the survey. So the survey questions were all not clear, and it may be helpful to use time today or in the future to go over the questions and what is expected to be ready for each. So Robert, I didn't know if you wanted to take a stab at this one or if we need to get more.
Yeah, I mean, I'd like to defer this one to Carrie. She's been very close to this.
Sure, thanks, Robert. This is Carrie Zanke working with the DDA in the Office of Change Management. I assume that this question is about the pilot interest survey that went out. And so, yeah, this is a great question from this person. So there's a number of areas, I think 11 areas that we ask providers to think about where they see themselves around those critical components for going live. And we really used that survey to get a sense from providers about where they think they're at. So then the regional directors who know and work closely with the providers can reach out, have those individual conversations, because I think, depending on the size of your organization or depending on if you're already engaging with LTSS, the responses to those questions might be different for providers. So we used it as an opportunity to get a sense and to help with the regional directors working individually with each provider to self-assess and then think about the timeline to a springtime pilot or another piloting phase later in the year, and really work with providers around what scope and what timeline makes sense. So great question, and there certainly will be individual follow-up around those areas.
Thank you, Carrie, for that. And please reach out to the directors who really are the integral part in this process and can provide some additional information. There is another question. I'm going to do a question for Robert, and then I'm going to do a question for Bernie next. The next question for you, Robert. By what date is it anticipated that all providers will be transitioned to LTSS?
Sure. So what I can tell you is that we have not been discussing any sort of drop dead date internally. As you know, we feel that it's important to get through the pilot and to make sure that the providers who are interested in a pilot get the chance to do so as prescribed by Senate Bill 796. So at this time, there's been no discussion about a timeline in which all providers will need to have been transitioned. That's not to say that eventually we won't be having those discussions, and when we do, we'll, obviously, we'll do that in collaboration you know, with the Maryland Department of Health.
Thank you, Robert. I'm going to go to Bernie with this question. Will you be awarding another grant for the inclusive higher education this year?
Yeah, we will. And if I look at Robert's slide, I thought it might have been on there, but I'm looking at it and he's got transition and youth waiting list, low intensity. So I don't know. 4% for the provider rate increase. There is money for the Maryland inclusive housing this year in the governor's allowance.
All right, Bernie. So I don't see any more questions in the chat. There are some of our statements. I think some people have been appreciative of all the questions and information. I think some of them is just please make sure that people are included when they are when they select committee members for the groups that came out. And I think, Bernie, I'm going to give it to you to close us out.
Well, this must be a record. It's 1:57, and we got 3 minutes left, or 2.5 minutes left, and we don't have any questions. So I hope today was helpful. I mean, we still need to maintain, you know, and what our vision is in moving forward. You know, sooner or later, this pandemic will be behind us. Hopefully we'll be able to, with increased funding, have the providers and people who are self-directing offer enough wages so that they can attract people to come to work for you. And again, you know, as we learn and keep moving forward, you know, we can only do this together. You know, I can't stress that enough. You know, we need to have open communication and collaboration, cooperation, and communication. So with that, I wish everybody a good weekend. Thank you.